Oh, that was great education by Mama Vio Swabwaja. I could still see the pictures again outlining how we can seek remedies before the court, just in case any of us is involved in an accident and we feel that we can pray to the court to get some section of the law on our side. But again, we run by you that we'll be having an interaction with the Member of Parliament for Nocton, a former Deputy Education Minister, but also a ranking for the Committee for Foreign Affairs in Parliament. And Samuel Kujeto Ablakwa is here. Good morning to you. How are you?
Hi, good morning, Roland. Good to see you.
Yeah, good to see you too. But when we have to do the overall conversation, I have to say that I first have to ask, I haven't asked you this before, how's your family?
You're doing well.
Yeah, great.
Doing very
I've been monitoring a lot on your Facebook page, and you seem to have a lot of activities, especially starting within the period when we had the lockdown or the restrictions before the lockdown, and now we've even lifted it. A lot of interaction. The last I saw was you having a virtual town hall meeting of a sort. How did it go?
Thank you, Roland. Let me convey greetings to all our distinguished viewers, and thank you very much for having me. Our virtual town hall meeting, which is the first we have had, and I believe the first in the history of the constituency, went very, very well. The feedback has been enormous. I was amazed with the level of enthusiasm, the engagement, and the fact that all facets of the constituency made time to engage. Chiefs, queen mothers, young people, and the youth were more vibrant, obviously, because they are the more tech-savvy population. And I must say that it's been very, very useful. We all know that because of the times we live in, there is social distancing, physical distancing. You can gather people above 25 in compliance to the Imposition of Restrictions Act. And it's all in our collective interest to make sure that we contain and limit the spread of the coronavirus pandemic. And so you have to be creative. You have to be creative. You don't use that as an excuse as a political leader to say that because of these impositions, so you will rather be AWOL or go missing in your constituency. You have to still engage. You have to still be accessible. You have to still make yourself available to the people, subject yourself to scrutiny, because there are still very important issues. Even on the pandemic, education ought to go down. People still want to understand exactly what they have to do to keep safe. Public education must be carried out, and members of parliament have that close engagement. They speak the language of their people. Their people listen to them. They have high credibility. And so when you join forces with the public health experts, with the Information Services Department and the NCC staff, you are able to enhance the communication. So it went very well. And let me add that right from the inception, we have been doing a lot in our constituency. As soon as the president announced on the 12th, on the 12th of March that Ghana has reported 2 cases. The next day, less than 24 hours after that, we convened a meeting of all the health workers, the public
in the constituency,
with the health directorate, the medical superintendent at the Bator Catholic Hospital, Dr. Tuguba, the head of the cervical cancer screening center, Dr. Kofi Efa, and others. And we strategized. So we put together a task force, and they provided a list of what we would need. And God willing, I was able to quickly mobilize resources and provided the items needed. It included PPEs, it included the usual hygiene requirements, detergents, Veronica buckets, hand sanitizers, and all of that. We did also add other equipments like infrared thermometers. We created a triage center at all our hospitals. Then we set out to expand an abandoned facility, renovate it and expand it for an isolation center. So we have an isolation center. And then we decided that as a district, we will insure all our frontline health workers. So we were the first to insure our frontline health workers for 1 year, a comprehensive insurance which covers our frontline health workers.
You mean with the National Health Insurance Scheme?
No, with Glyco, with Glyco Insurance.
Okay. So you went private?
And yes, we went private.
As a public official, you don't trust the National Health Insurance?
No, you know, National Health Insurance does not carry out. We are talking about comprehensive life insurance, not insurance for healthcare, what we all use. Yeah. This is
a normal life insurance.
This is
policy.
a normal life insurance policy. Yeah, and because of the risk, if something happens to you, we can take good care of you financially, your spouse, your children, all the way to the graduate. So very enhanced terms.
What did you notice while you were having these interactions with the health officials about the provision of PPEs and other forms of protective equipment in the first place?
It appears to me that there is a challenge with the distribution chain. Those of us removed from the capital, outside Accra, continue to see lack of attention, inadequate supply of these PPEs in particular. Only yesterday, the medical superintendent in a discussion with me said that so far the Bato Catholic Hospital has received only 17 PPEs. That's not acceptable. Yes, and that's a major facility. That's a frontline health facility. You've heard the Ghana Medical Association reps in the Ashanti region complain about inadequate supply of PPEs, and there are reports coming from all over the country. So you've had to see, you know, individuals like former President Mahama, corporate institutions stepping in to assist. Meanwhile, when we listen to the president, he mentions huge figures, and we know that we've had some donations as well, the Jack Ma Foundation, Chinese government, the United States government. So is it an issue with the distribution, how to ensure that it is accessible and it reaches every part of Ghana?
So you are in no doubt that at least we have enough PPEs at least to cover some of the pressings or the community that are closest to the capital. That's what you're saying?
What I'm saying is that if the president's announcements are to be believed, then it is a challenge with distribution, how to get the items in the districts, because we are not seeing the key protective gear that our frontline healthcare workers need. I cannot speak for government whether we have adequate supply. I cannot. I want to take government by its word when government says that they have a good number in stock. But the point I'm making is that we are not getting it, and we must be concerned about that. The other interventions that we have carried out in the North Town constituency is that we have mobilized all the local tailors and dressmakers, and we are producing face masks. So far, 20,000 face masks for free distribution. And we are doing that in the spirit of what the health experts have told us, that when you wear your face mask, you protect yourself and you protect others. And you do know that since the lifting of the lockdown, the President Akufo-Addo has admonished that as much as possible, wear a face mask. And if you are stepping out of your house, make sure that you are putting on a face mask. And so these face masks must be made available. We thought that when we mobilize local dressmakers and tailors, remember that SMEs are struggling in these times. Nobody is attending social gatherings, weddings, funerals.
The SMEs are struggling, but at least we do know that there's a package that has been announced that will be supervised and disbursement by the NBSSI. So that has been taken care of. And I'm sure you're a member of parliament, so those approvals were done by you as well.
Yes, but first of all, that amount, 600 million cedis, is woefully inadequate. Two, we are waiting for the criteria for disbursement. It's not yet been operationalized. So we are all looking forward to what the criteria will be, and we hope that it will be a fair, transparent criteria, not subjected to any familial or, if you like, subjective dictates. But back to what we are doing in the constituency, we're making sure that our SMEs, the tailors, the dressmakers, get some business, revive their business activity because of the dwindling fortunes. And at the same time, we are making sure that we keep safe. We are glad to note that so far, not a single case out of the 17 suspected cases, all have turned out to be negative, and so we are keeping the virus out of our constituency. I must indicate also that we have done other interventions, which includes the distribution of over 6,000 books to our students who are at home. As you know, schools have been closed, and in largely rural constituencies like mine, where online learning is a luxury, and distance learning is not that, far-reaching. What you do is to make sure that you ensure that they all have reading materials. And so we mobilized over 6,000 books, which we have distributed to all students and pupils at home. You do also know that we converted all our party vehicles, rebranded them into public education vans. We put out COVID-19 outreach, and there are all kinds of the protocols, well designed, and we're using it because we don't have the NCC, in our district.
Information goes down there.
Yes, it goes down there, and in partnership with the public health workers, and it's been going very well. We've also renewed the health insurance cards for 1,500 people, and during the lockdown, we reached out to our constituents in the lockdown areas who needed support, and we did cash transfers to about 240 of them. So it's been quite a busy time, but we are all putting our shoulders to the wheel to make sure that our people are protected and kept safe.
As a former Deputy Education Minister, and you were in charge of tertiary. Okay.
Yes.
Now, you look at the initiatives so far that have been taken for tertiary institutions to be able to continue teaching and learning. And we were able to aggregate many of the vice chancellors and the various chancellors right here, and the directors of academics at the various universities on this channel. You look at the means by which they've enabled students to be able to get that some form of education. That should be commendable in any way.
Absolutely. And I recall that when we served at the Ministry of Education, we carried out enormous investments in providing the infrastructure for online and distance education. I recall the major broadband installation that former President Mahama supervised, and that is what stretches from Greater Accra all the way to the OT region. And so a new university like UHAS, the University of Health and Allied Sciences, is today able to carry out online learning for all of its students, and lecturers are able to engage with their students because of that
You mean the fiber optic?
That fiber optic,
okay.
Investment that was made. I also recall that the University of Ghana, I was even asked to commission that project. We launched their online, and it was a support from the government of Ghana and the Chinese government. We launched their online portal, again, making sure that the needed fiber optic cables are provided. So I'm happy today to see that all of these investments have come in handy. And I think that it's a wake-up call that the old ways of doing things, because in other jurisdictions, even before COVID-19, they made more use of technology, and it was a beautiful mix between the physical presence, going to the lecture room to meet your lecturer, which has a lot of advantages, which must be regarded. But you also must create the needed platform for students to be able to learn at all times. Those who even do other activities, who are workers and all of that, should be able to work and even be able to learn from work and from other engagements that they have. So I'm glad to be seeing these investments. Remember also that there was massive distribution of laptops at the time under former President Mahama. Unfortunately for the laptop programs, it appears that those social interventions are no longer being carried out. I will have hoped,
because the laptops broke down, they were not good enough.
I will have hoped that it's better than none. And remember that we were encouraging local producers. So, I mean, you remember how Toyota started? Toyota today is one of the top vehicles. Kia and all of that. Hyundai, yeah. So it's always good to invest in your own. And we had told the local manufacturers to step up, and with more of these contracts, they will get better. And so I want to see that aspect as well taken care of, even if it will be some subsidy, even if it will be fees probably being reduced, so that students can buy laptops, can have gadgets, if it's iPads or tablets or mobile phones that they will use to be able to be more useful in the cyberspace. It will be helpful. So I'm glad to see the strides that we are making, but let's remember that it's still quite expensive. There's a lot more we can do in providing gadgets. Then I'm also concerned about the cost of data. And our flag bearer, the former president, has been advocating for some time now that we should do something about the cost of data, because this is a time that many people are working from home. Students are using online portals. You need to ensure that the cost of data is affordable. Look at the imposition of the communication service tax, for example, 50%. We can take that off. Former President Mahama has made that suggestion. If you take that off, it will drive down the cost of data. Another option available to us is that very soon the telcos licenses will be up for renewal. You can defer the renewal because it comes to them at huge cost. Very, very, very expensive to renew your license. So you can defer that, and then the windfall will be plowed back for customers to benefit. That will also drive down the cost of data. So it's not only an issue of the end user and how the universities are positioning themselves and creating the online environment. But it has to do with so many other facets, the costs of data and the support we can give to students in terms of these gadgets that will help us realize the full potential of IT education.
In February, I believe by close of February, you were advocating that the Ministry of Foreign Affairs, indeed the government of Ghana, should evacuate Ghanaian students from China or Wuhan, specifically within the Hubei province. Do you regret that decision in the first place, looking at how government has put in place the outlines for fighting coronavirus?
I'm glad you bring this matter up. I have absolutely no regret for that position. I am very proud, rather very, very proud about that position that I took. And I must quickly dispel that fake news. You know, the WHO has said that they are not only fighting a pandemic, they are also fighting an infodemic. Government propagandists have said that, oh, if we had listened to Okujeto Ablakwa, Ghana will by now be like Italy, be like France, be like America, because Italy, France, America evacuated their students, and see what has happened to them. Blatant falsehood. That is fake news. Check the cursory reading. The cases, the first cases in all of these countries had nothing to do with evacuation. Indeed, the science shows that evacuation is your best bet, because evacuation follows protocols. Before you evacuate any group of people, you test them to be sure that they are negative. If you are positive, you don't go on board the flight. When you have arrived at your destination, you are quarantined. You are put under compulsory quarantine for not less than 14 days. And you are checked. There's a video of the South Africa student evacuation, Cyril Ramaphosa. You know,
I've watched that.
Yes, you've watched that video. And then he says that, look, it's after 14 days, you are all clear. It's now been moved from a red zone to a green zone. You can all go home. So evacuations are your safest things. I say that it did not make sense that when you prevented our students from coming in, you refused to evacuate our students, yet you kept the borders opened. Several weeks, you kept the borders open. And flights were coming in even from China. Remember that the Wuhan epidemic spread to mainland China. And so many countries stopped flights, including the United States of America. They were the first country to stop flights from China. Then other countries followed. We in Ghana, we blocked our students from coming. We said it was too risky, it was dangerous. Something that no country does. When you are a nation, your ability to take your nationals from harm's way. All those who were saying, oh, it was a reckless call, it was not safe. Will you say same if it was your child in that situation? If you were the student in Wuhan? So the over 100 countries who evacuated, are we saying that we are wiser than those countries? In Africa, look at the number of countries that evacuated their students from Wuhan. You can mention South Africa, Morocco, Tunisia, Libya evacuated their students. Mauritania, Kenya, they all evacuated their students from Wuhan. So even when you listen to government at the time, there were conflicting reasons. First, they claimed that it was too risky. Then you heard the foreign minister say that because we didn't have a national carrier. Then I had to point out that, look, if your excuse is that we don't have a national carrier, other countries are collaborating. They're having bilateral, multilateral collaboration. New Zealand and Australia, for example, use one flight. EU countries, UK, France, and Belgium, use a common flight. In Africa, Libyan students, the Libyan authorities negotiated with Air Algiers, and the Algerians evacuated their students on behalf of the Libyan government. So that excuse they gave was not tenable. I just think that we were not up to the task. We didn't show enough empathy, and the attempt to do post-facto rationalization and propaganda, which is all fake news. In any case, you didn't evacuate your nationals from Wuhan. Did it prevent the virus from being imported? So many importations have taken place. Now, as we speak, look at where we are, over 2,700. It was a bad decision, and we must resolve as a country that never again, no government, no Ghanaian government should be proud that it left its people in harm's way. It is not done. It's an indictment on the present leadership.
I have a statement here from the Ministry of Foreign Affairs that was issued within the period, and it's indicating, it says the Chancery and officers of the Ghana mission in China are in touch with us.